Alright, what's up guys? So today what we're going to be doing is the Scat 5 Sport Concussion Protocol with my man Jordan Patterson. So today Jordan is going to be my patient. So we're going to be doing a baseline concussion evaluation form on you. So basically what this form is we gather data on how Jordan's neurological system functions at a normal baseline level. And so this level will be compared to in the event that he actually has a concussion. So we have all these numbers, all these data that we'll have, and then we'll look and compare and contrast to see how basically severe the concussion is or what region of the brain is affected. So to start off with, basically what we will do is I'll get a history of Jordan and his past concussions or any other head trauma, psychological disorders, learning disability, headache disorders, things like ADD, ADHD, or any psychiatric disorders like depression, anxiety, things like that. So Jordan will kind of answer those questions for me, and then I just kind of keep a checklist on how many of those he would have has been checked out for, been to the hospital for, and then his concussions, how many he's had, any recent concussions, and how long his recovery time was. So Jordan, this next step, what we're actually going to do is a symptom evaluation sheet. So I'm going to hand this to you, and you're just pretend like filling it out. So Jordan's going to fill out a symptom evaluation sheet that'll have things like headache, pressure in the head, neck pain, nausea, vomiting, difficulty concentrating, remembering, things that are just kind of showing what happens in the brain, and if things are affected, he will have symptoms that'll show. So now he's looking at it, and he's filled out either 0 being no symptoms at all, 1 to 2 being mild, 3 to 4 moderate, severe, or moderate, and then 5 to 6 is actually going to be the severe rating. So now we're actually going to do the fun stuff with Jordan. So this step 3 is going to have 4 different tests, questionings, I guess you could call them. So this first one, Jordan, could you give me today's full date?
Today's date is July 20th. Scratch that. Today is July 20th, 2020.
Perfect. What day of the week is it?
It is currently Monday.
Monday. Wonderful. And about what time is it? Give me your rough estimation.
I would say 1:45 to 2.
Okay. And it is 1:44. Wow. Almost spot on. All right, next I'm going to test your memory, okay? So I'm going to say 5 random words. You're going to repeat them back to me, but in any order you remember them, okay? Elbow, apple, carpet, saddle, bubble.
Elbow, apple, carpet, saddle, bubble.
Perfect. So he got all 5 of those right. I'm going to do that again. I'm going to say those and you repeat them back to me. Elbow, apple, carpet, saddle, bubble.
Elbow, apple, carpet, saddle, bubble.
Perfect. So we got 5 out of 5 on that one, and I do it one more time. Elbow, apple, carpet, saddle, bubble.
Elbow, apple, carpet, saddle, bubble.
Perfect. So he got all 5 of those each time. So he would get counted with a 15 for his immediate memory score. This next one is going to focus on your concentration skills, okay? So I'm going to read a string of numbers. You repeat them back to me, but in reverse order. So if I say 1, 2, 3, you would say
3, 2, 1.
perfect. 4, 9, 3.
3, 9, 4.
Good. So I mark yes, and he gets a point for that first one. This next numbers 3, 8, 1, 4.
4, 1, 8, 3.
Perfect. Gets the next point. Now we're going to 5 digits. 6, 2, 9, 7, 1.
1, 7, 6, 9, 2.
It's close. You switched them up. So you still technically he still counted right for that one, even though he missed the 2 switch places with the 2. So we'll go to the next one. The last one. 7, 1, 8, 4, 6, 2.
2, 6, 4, 8, 1, 7.
Perfect. You got him. That's a hard one to get. So this
Cheat
next
codes.
cheat code. This next one is what I'm gonna have you do is you're gonna say the months of the year, but in reverse order. So go December, November, and go all the way through.
Okay. December, November, October, September, August, July, June, May, April, April, March, February, January.
Perfect. All right, so he passed for that one. Next is going to be a neurological screen. This first question is having him read aloud the symptom checklist that he did earlier. Obviously, he did it already since he filled that out, so I would check yes. The next is looking for passive cervical range of motion if he has any pain with that. So you can just come up to him and just move the head. Backwards and forwards. So, any pains at all with that?
Okay.
No. So you mark that one down. And then the next one is, without moving your head or neck at all, do you have any blurriness or double vision moving your eyes side to side at all?
Nope.
Nope. So he's good on that one. And then this next one is testing his coordination. So I'm gonna have you extend your finger out all the way. And I want you to touch your nose and extend back out for me. Good. And then try to do it faster. Good. So you're testing, again, coordination. He passed for that one. This next is going to be balance. All right, so we won't actually do the full exercise. I'll just show you how to set him up. So the first one, what he will do, actually I first asked what his non-dominant foot is, or if you're asking younger kids that don't really fully understand a dominant, you kind of ask them what foot do they normally kick with. So they'll usually say most of the time the right foot, so you have the left foot as the non-dominant foot. So we'll actually do a single leg stance after the first one, but the first one is a double leg stance. What I'll have you do is put your feet together, heels and toes as best you can. And then what you'll do next is put your hands on your hips, and then when you're ready, you're gonna close your eyes. But if you fall out of this position, you come back, recenter yourself. And so basically I have him closes his eyes, he tries to stay in this position. If he kind of falls out, his angle comes to the side. If he bends further, I think it's past 30 degrees with trunk lateral flexion, then that counts as a point. Or any hands coming off the hips at all, that would count against him. So I just kind of mark how many times he does it in the 30 seconds. So 30 seconds is up. Next he goes to the single leg, and he makes sure that, face that way for me real quick. So he makes sure that the right leg does not come in contact. So go to your non-dominant, so your left foot. You kick off your right foot. That's your non-dominant, okay.
Yep.
So you're on your non-dominant foot. So making sure this leg does not touch the other leg at all. So you're looking for that space. And then that back toe does not touch the ground to help him balance there. But again, if he falls back, he can come back into the standing position. And then the last one is a tandem stance. So your right foot is going to be behind your right, and you're going to have them heel to toe, and you're going to make sure you're walking on a tightrope. So it's your back toe is a little shifted farther this way, so make sure it's lined up perfectly behind you. Perfect. So again, hands will go on the hips. Yeah, you've seen it from the side view. Hands will go on the hips, and then eyes closed. And for both of these, I could be standing here at the side to catch him in the event that he really falls over. But most of the time, most people can catch themselves if they do fall. All right, and then that's it. So you can come out of that position. And then the last thing, do you remember those 5 words I asked you earlier?
Car, apple.
What was that first one?
Bubble. Was it car?
Not quite.
Apple, bubble.
2. That's good. So he got 2 out of the 5. So it would be elbow, apple, carpet, saddle, bubble. Those are always hard. I memorize them because I've done so many of them. So the main one that you guys obviously can guess, the cranial nerve that we're testing is obviously balance, and that's vestibulocochlear. The rest of them aren't as much of cranial nerves. They're mainly looking at the cognition and then the symptoms of the athlete at the time of concussion or post-concussion. So yeah, that's basically it. The Scat 5 baseline concussion assessment tool. So thank you.